have, if you look on here, it starts with a G. So G is gastro. Very simple. G is on there, on the screen, telling you that it's a gastroscope. They're also a shorter scope. They also don't have scope guide. The other gastroscopes that we have is so this is a therapeutic, I should say. So the TH is in here. This is for bleeds. So the channel is huge, the scope is huge. I would not want that down my throat. So unless you're having an active bleed, they usually don't use it. Normal gastroscope is technically a slim gastroscope. It's just the name of it. It just has a G, doesn't have the TH. Channel is 2.8. So this is a whole almost millimeter bigger. And then we have the ultra slim, which is that really, really skinny gastroscope that doesn't have the foot pedal, or doesn't have the, thing in it. So that's super small, it's 2.2. So you have to use the ultra slim biopsy forceps. Nothing else will fit down that. The same thing goes for the colonoscope. So we have the standard colonoscope, so it just says C at the beginning, or colon. Thanks. Then we have the pediatric colon, which is slightly smaller than a normal colon. It has a P in front, so pediatric colon. The channel's only 0.5 difference, but you still can't fit a large biopsy forceps down that. And then we have the pediatric colonoscope therapeutic, which is no scope guide, but it is the closest to our old RetroView. So Simon's is famous for it. He will ask for the RetroView, but you need to clarify if he wants the scope guide or not, because if he wants the RetroView, that's the 210 bending in new terms, it does not have scope guide, and that will drive him crazy. So lots of times they will bump from the regular colonoscope down to the pediatric colonoscope, and that will sometimes give them just enough size difference to make it through the patient with the scope guide. If that doesn't work, then they'll bump down to the 210 bending, which is smaller, no scope guide. But the bend is huge on it to try to get around some of those corners in the patient. There was something else Anne asked me to talk about. Scope handling, this. I should talk about the endocart. It is fully stocked every week by Anne, which is so not her job. You can see right now that cart is an absolute disaster.